Okay, good afternoon and hi everyone, welcome. So I am Dhanvi Kaur, from team leader from Astron Institute of International Study, Gurgaon. So today we have a webinar on the oncology and the topic is PRAME, that is patient reported experience measure. So before starting the webinar, I just want to introduce our organization, that is Astron Group. So we are 18 years old company focused on planning, designing, also doing quality and accreditations for hospitals by doing NABH and JCI. Kindly mute yourself. And also we are offering 50 plus certificate and diploma programs for nurses and paramedical technicians, adopting a blended approach with major focus on practical learning through on-job training. Right now, more than 10,000 plus nurses are certified and well placed at national and global level in reputed organization with the NABIT ISO 17024, and also proud to tell you that now we are also training partner with Skill India. Now I would like to introduce our expert, Ms. Deepa Chugh. She has 21 years of experience at various capacities in clinical practice, academics, quality, and administration. She is also an ABH assessor since 2017, published various scientific papers in national and international journals, expert speaker at various forums, author for chapter in nursing books. So now she is working as a nursing superintendent at Akash Hospital at Dwarka, Delhi. So now it's over to you, ma'am.
Thank you. Thank you for the introduction. And I should just congratulate Astron that you have selected such an hot topic, which is the talk of the town in healthcare, quality healthcare, because a newer concept, I would say, because in India, per se, we give the best of the care, but forget involving the patients. So here, as the platform for healthcare overall is changing and globalization is happening, and people are getting more and more aware about their rights, what they can get, and their partner in care. The topic which we are going to discuss today is patient-reported experience measure. It is synonym as PREM. आप प्रेम भी बोल सकते हैं, पेशेंट को प्रेम के साथ अपने साथ में ले चलिए, ठीक है. So there are two basic aspects. I would just brief you all. PREM ROMs, people get confused. We will this time talk about only patient experiences and get clarity. I'll try to give you all more practical inputs, because theory पढ़ के काम नहीं चलने वाला है. You have to get it implemented. That is what Astron has been, doing it from the time they have started the platform. That they want people to be industry ready. They want skill development, and looking into that agenda or fulfilling that agenda, we will emphasize on the practical aspect. A brief will be given to you all, and thereafter more question and answer, the more you will ask on the tools which I will share. Now, we'll just see what exactly quality, when we say quality. Quality is a aspect which will involve three, triangular parameters. The first and foremost parameter is safety. When we say safety in healthcare, we are talking not only the safety of the patient, we are also talking about the safety of healthcare professionals. So safety, when we measure safety in terms of quality, we are talking about summary of hospital mortality indicators, that is SHMIs. Mortality indicators are many, starting from patient's entry to the hospital to ICUs, and whether the mortality is being measured or not measured. So those are different aspects. Then incident reports. I'm very sure that all of you all in today's time are aware about what is the incident report. Gone are the days when we used to call it as sentinel event. We now call it as never events. Never events means एक hospital में कुछ ऐसी चीजें नहीं होनी चाहिए. Never ever this should happen. Those are never events, and few more other things like infection control and all. Those are the things which are dealt in patient.
आपके पास इडली बनाने वाला साचा है क्या?
You will continue, please, Tobias. Patient next comes the next aspect, next parameter of quality is patient experience. Say if I am a patient, what was my experience can differ from your. समझो आप एक पेशेंट हो और मैं एक पेशेंट हूँ, तो आपका एक्सपीरियंस और मेरा एक्सपीरियंस डिफरेंट हो सकता है. It can happen that the same treatment has been given to you and the same treatment has been given to me. Say for example, a simple appendectomy. Now you also underwent appendectomy on the same day. I also underwent appendectomy the same way, same day. I also am in the general ward. You are also in the general ward. The same nurses taking care, and everything was similar. But it can happen that your experience differs than my experience because there is subjectivity. Subjectivity मतलब आपके विचार और मेरे विचार अलग हो सकते हैं, और वो गलत और सही नहीं है, सब कुछ सही है. आपके विचार भी रिस्पेक्टेड है, मेरे विचार भी रिस्पेक्टेड है. So PREM, when we say patient reported experience measure, that means the first thing which in quality which will give you about the patient experience is the PREMs. We'll learn in detail. Compliments and complaints हर hospital आज की डेट में करता है. We have a service excellence department or public relations department. They go to each patient, ask their complaints, even not only complaints, feedbacks आते हैं उनके पास में, compliments भी आते हैं, online भी चीजें चलती हैं आजकल. So all these things would come under patient experience, and those are analyzed and presented. So we come to know whether any patient is getting satisfied in our hospital. So when we say satisfaction and experience, they are two different.
Yes, sir.
We will be discussing about it little different in further slides. That when we say patient satisfaction मतलब क्या होता है और experience मतलब क्या होता है, दो different चीजें. ठीक है? The last or very important aspect of quality is clinical effectiveness. Because of that only patient is here. Patient अपनी treatment करवाने आए. So till the time patient you are not checking that whether the treatment given was effective or not effective, then there is no fun. There is no fun running a hospital also. So that can be done through PROMs, that is patient reported outcome measures. Outcome measures मतलब patient की treatment हो गई और treatment होने के बाद में you are checking कि जो असर होना था, say for example, X drug was supposed to reduce the pain. Did that drug actually reduce the pain or did it not? Surgery was supposed to improve the urine output. Did it actually improve the urine output or not? Dialysis was supposed to be removing the fluid from the body and the toxins from the body. Did it actually reduce it or not? So those are certain things which prompt us, that is outcome measures, patient reported outcome measures. Clinical audit also does that similar thing, but we are not involving the patient in clinical audit. We are putting it on parameter basis. Say a particular say ACLS protocol, वो ठीक से हो रहा है या नहीं हो रहा है, that is clinical audit. Then many things, readmission rates, reintubation rates, return to ICU, all these things would come under clinical effectiveness. So medical operations related जो KPIs होते हैं, those would come under clinical effectiveness. Now you know that quality के अंदर तीन basic parameters हैं, safety, patient experience and clinical effectiveness. आज जो हम बात करने वाले हैं, we are just going to talk about patient experience. In patient experience, we are going to talk about PREMS. PREMS is nothing but a tool. आप कैसे पता करोगे कि पेशेंट को कैसा लगा, ठीक है? The definition which of PREM it says that it is patient-reported experience measure, gather information of patients' views of the experience while they are receiving care. मैं अगर एडमिटेड हूँ ये हॉस्पिटल में, तो मेरा अभी का एक्सपीरियंस क्या है, वो होता है प्रेम. They indicate the quality of patient care received by the patient, although they do not measure directly. PREMs are most commonly in the form of questionnaire. आपका ट्रीटमेंट नहीं मेजर कर रहा है, आपका सिर्फ एक्सपीरियंस, खाना कैसा था, नर्स ने आपसे ठीक से बात की कि नहीं की, आपको हर रोज डॉक्टर ने काउंसलिंग की या नहीं की, दैट ऑल विल कम अंडर प्रेम. ये नहीं देखा जा रहा है प्रेम में कि आपकी जो ट्रीटमेंट हुई, जिसके लिए आप आए थे, वो हुआ कि नहीं हुआ, टीपीए आपका क्लियरेंस हुआ कि नहीं हुआ, did you had any problem with the TPA got stuck up somewhere and thereafter you had to pay cash. So वो सब कुछ नहीं देख रहा है प्रेम. प्रेम is just looking for your experience. उस समय आप जब समझो आपका दूसरा दिन है सर्जरी का, so on the second day of your surgery, what is the experience? आपका TKR हुआ, आपके एक रिलेटिव का TKR हुआ. So पेन मैनेजमेंट कैसा था, आपको दर्द हुआ तो नर्स ने आपको कुछ डॉक्टर को बुलाया कि नहीं बुलाया, ट्रीटमेंट दी कि नहीं दी, डॉक्टर ने आपसे आके पूछा क्या, आपका पेन स्कोर किया क्या. सो ऑल दीज थिंग्स वुड कम अंडर प्रेम. दे कैन बी क्लासिफाइड इनटू, they are basically relational in nature. You can have two types, that is functional prems and relational prems. Functional prems are they will examine the practical issues. Say for example, dialysis unit. So when you went to the dialysis unit, did someone check your weight? Did the nurse receive you? After that, what were your vitals checked? Was the new kit opened for you or not? So all these things would come under functional prems. There is something which is called as relational prems. Relational prems are the experiences out of relationships during treatment. Something like, did you feel listened to? That means आपके डॉक्टर ने आपके सुना क्या, 2 मिनट आपको दिया कि बस आए और राउंड लिए फटाफट, आप कुछ बोलना चाह रहे थे और आपका सुना भी नहीं. नर्स को आपने 8 बार घंटी बजाई, उसने आपकी नहीं सुनी. So those are relational prems. So these are basic. You can have combination also. आप समझो अगर डायलिसिस यूनिट का आप प्रेम करना चाहते हैं, तो आप दोनों एस्पेक्ट्स ले सकते हैं. आप फंक्शनल एस्पेक्ट भी ले सकते हैं, आप रिलेशनल एस्पेक्ट्स भी ले सकते हैं. So usually we do that. We take both the aspects. Now, why do we require prem? आज तक तो हमने नहीं किया, तो आज हम क्यों उसके बारे में बॉदर कर रहे हैं, हम क्यों बात कर रहे हैं? We all know that to err is human. मतलब मिस्टेक तो किसी से भी होगी, आपसे भी होगी, मुझसे भी होगी, बट सुधारना हमारा काम है. क्या हम 25 साल तक, 26 साल तक हम यही करते रहेंगे? हम मिस्टेक करते आ रहे हैं, हम करते भी रहेंगे. ऐसा नहीं होना चाहिए. Somewhere it has to go down. We know that we have various mechanisms to reduce those errors, but still those errors are continuing. One study from UK, which is the NHS, which is the National Health Services, which are there of the United Kingdoms, it had given some data, recent data from there. It has stated that from 2018 onwards, they have seen the events, surgical events, never events मतलब जो होने नहीं चाहिए, जैसे एक गॉज रह गया, सर्जिकल इंस्ट्रूमेंट रह गया, या शार्प इंजुरी हो गई, तो these are never events. In spite of that, you see the numbers which are happening. देखो कितने सारे numbers हैं. You have in 400s. इतना सब कुछ होने के बावजूद इतने errors तो हो रहे हैं ना. So we have to find out some solution. And what are the solutions? Few of the solutions are that we are already following checklist. We are following clinical pathways. We are having SOPs, policies, protocols, processes. हर एक के हॉस्पिटल में आजकल मैनुअल्स हैं. Say if you're working in cardiology, then you have a cardiology manual. You're working, say, in liver transplant, you'll have a separate liver transplant. लिवर ट्रांसप्लांट का होगा, नर्सिंग का लिवर ट्रांसप्लांट का अलग होगा, रीनल का अलग होगा, MICU का अलग हो जाएगा, सर्जिकल ICU का अलग. So we have all those protocol sets. We are doing regular clinical audits. In spite of that, the question comes, are we actually doing enough? कहीं तो कुछ गड़बड़ है. There is a weak link. And we need to find out, in spite of doing all these, where is that link which we are failing? And that gives us that in spite of the intensive monitoring at each step and each care area, you just have to give me a, sorry. So the thing is that intensive monitoring should involve patient experiences also. हमें पेशेंट से भी बात करना है, हमें पेशेंट को भी पार्टनर बनाना है. मेरा, अगर मैं पेशेंट हूं तो मेरा काम सिर्फ बिस्तर पे सोना नहीं है. मुझे भी देखना है कि did I get my medicine? The nurse who was coming to me, was she wearing gloves while taking my sample? Did she sanitize her hand? The doctor came, how much time did he spend? He was supposed to get a MRI ordered for me, or insulin start करना था आज से, किया कि नहीं किया, मुझे ठीक से टाइम दिया कि नहीं दिया, या हड़बड़ी में थे. The technician who came did not even tie a tourniquet, और मुझे बहुत पेन हुआ. So these are nothing but patient reported experiences. So in spite of all these जो हम कर रहे हैं, checklist कर रहे हैं, audit कर रहे हैं, clinical pathways कर रहे हैं, we are doing a lot of case studies, we are doing validation test amongst each department. We also call people from outside to come and do audits in our hospitals. कहाँ gap है? तो gap ये है कि हम patient को involve ही नहीं कर रहे हैं. That is a major gap, and that is the reason why we say that PREMs are specific self-reporting instruments that measures perceptions of experience while receiving the care. आपके सब हॉस्पिटल्स में आप पेशेंट सेटिस्फैक्शन के लिए आपका एक डिपार्टमेंट होता है जो हर पेशेंट के पास में जाएगा और फॉर्म भरवाएंगे, या हर एक से जाके पूछेंगे क्या है क्या नहीं है, फलाना ढिमकाना, आपको सब वो लोग बताते हैं. पर वो सिर्फ ये पूछते हैं कि कंप्लेन है क्या, कोई कंप्लेन है क्या. Now patient doesn't know that what are you actually asking. So when you put it into a questionnaire, when you put it into say 6, 8, 10, 15 questions, but it should not happen that 30, 35, 40 क्वेश्चन आप बना रहे हो, फिर कोई भी पेशेंट को मजा नहीं आएगा करने को, वो आपका पार्टनर कभी नहीं बनेगा. So you'll have to make it crisp, you'll have to make it very target oriented. So in that way, you'll have to make sure that you are coming up with some questionnaire which would ask experience of the patient. Questionnaire based surveys can be done. Survey क्या होता है? When you're taking larger number of patients, या आप जितने भी एक जनरल वार्ड में से 35 पेशेंट्स आ गए, आपने सारे 35 पेशेंट्स का सर्वे कर दिया, आपने 2 हफ्ते का सर्वे रखा, आपने सारे पेशेंट्स जो आए उस वार्ड में, समझो वो कार्डियक वार्ड है, तो आपने कार्डियक वार्ड में नर्सिंग का एक्सपीरियंस जानने के लिए आपने किया, आप कर सकते हो. आपने फूड क्वालिटी का जानने के लिए आपने एक्सपीरियंस किया, आप वो भी एक क्वेश्चन बना सकते हो. So this helps in establishing in the team members that implementing it has to be protocol based. मतलब अब देखो, अगर if I want to do it in a ward, 35-40 patients are there, can I do it alone? No, I will not be able to do it alone. I will have to do it into different phases, or I will have to involve people in it. We'll require a team. So for that team, we'll have to have people who would know the protocol, people who would be trained कि आप कैसे जाके क्या करेंगे. एक सिंपल सा मैं आपको एग्जांपल दे रही हूँ. क्वेश्चन ऑन सर्जिकल साइट मार्किंग. every सर्जरी, बिफोर एवरी सर्जरी साइट मार्किंग होती है, और वो कहाँ होनी चाहिए? सर्जरी से पहले होनी चाहिए. वार्ड में आईसीयू में. Patient cannot come enter the OT without surgical site mark. Now we did a audit. Okay, I am giving you this practical experience. We did a audit and we came to know that बहुत बढ़िया हमारे hospital में 100% surgical site marking हो रही है. Now एक event हुआ. Now that event, when we did the RCA of that event, we found out that site तो मार्क ही नहीं की. ऑडिट में हमारा आया 100% साइट मार्किंग, बट प्रैक्टिकली जब इवेंट हुआ, आरसीए किया, तब पता पड़ा साइट मार्किंग ही नहीं हुई. एंड दैट इज व्हाई द एंटायर इवेंट टुक प्लेस. सो वेयर वाज द गैप? कैसे? इसका मतलब कहीं तो गैप थी. देन वी डिड अ प्रेम ऑन दैट. व्हेन वी डिड अ प्रेम ऑन दैट, वी केम टू नो that many of the patients, we found out that patient said that हमें प्री ऑप एरिया में साइट मार्किंग हुई. डॉक्टर ने वार्ड में नहीं किया था. डॉक्टर ने प्री ऑपरेटिव एरिया में किया. व्हेन प्री ऑपरेटिव एरिया में किया था, मतलब इट इज नॉट एज पर द प्रोटोकॉल. सो सी, वी लॉस्ट अ लिंक. क्लिनिकल ऑडिट में हमारी तरफ से सब कुछ बहुत बढ़िया चल रहा था अस्पताल. फिर अब क्या हो गया? अब क्योंकि हमने पेशेंट को बताया कि भाई आपका अधिकार है जानने का, आपको होना चाहिए. Thereafter, when we saw this in the prem, that the surgical site marking, many of the cases are done in the pre-operative area of the operation theater. So what we did is, now corrective action उसका क्या लिया हमने? Corrective action हमने 2 corrective action किए. एक, पेशेंट को ड्यूरिंग द एक्सप्लेनेशन, कंसेंट देते समय, इन्फॉर्म्ड कंसेंट के समय हमने बताना शुरू किया कि आपकी सर्जिकल साइट मार्क की जाएगी. अगर आई पे है तो कहाँ मार्क की जाएगी, लेग पे है तो कहाँ मार्क की जाएगी, और डॉक्टर आपको वार्ड में आके मार्क करके फिर आपको ओटी में लेके जाएंगे. सो द पेशेंट इज अवेयर अबाउट इट. सेकेंड इज, we empowered our OT nurses, pre-op nurses, that you will not receive a patient until and unless there is one, consent, second, site mark. अगर ये 2 चीज नहीं है, आप अंदर लेंगे ही नहीं पेशेंट को. I know शुरुआत में थोड़ी दिक्कत आई. The doctors were not happy about it. They made a hue and cry about it. But then when we stood up, when the management said, no, we will follow the protocol, believe me, right now, 100%, including the patient's feedback, including experiences from the patient, we are doing site marking, and that has become a habit for every surgeon. The surgery team, someone goes and marks the site. So there is no gap at all in these areas. This will, अब इसमें कौन सी बड़ी बात हो गई आप बोल देंगे? बड़ी बात तो है, क्योंकि पहले नहीं हो रहा था. और इतने सालों में अगर एक इवेंट भी होता है, दैट इज अ नेवर इवेंट. नेवर इवेंट मतलब वो कभी होना ही नहीं चाहिए था. Patient safety was compromised. Even if it is compromised for one patient, then patient safety gets compromised. So even that one patient is important patient, because that patient can be the breadwinner of the family. That patient can be brother of someone, husband of someone, can be my family member. It can be me. Then why? जब जिसका समय आएगा वो होगा, वो है, पर हम खुद होके समय नहीं ला सकते हैं. So these all measures would improve your quality of services you are giving. And also, with the awareness in today's world, things will become better. Patient will understand कि ये hospital कुछ छुपाता नहीं है, ये hospital हमें हर कुछ बता के फिर कर, which is a important thing. Let's discuss on certain potential uses of prints, where it can be used. It is useful measure for what actually happens in care episode. Like I told you, surgical site marking. This is a care episode. One single time only it will happen. But patient would actually know अब इट्स अ प्रोटोकॉल. प्री ऑपरेटिव टीचिंग में हम उनको टाइप मार्किंग का बताते हैं कि आपका रिप्लेसमेंट होने वाला है लेफ्ट में, और डॉक्टर साहब आके इधर आपको मार्क करके जाएंगे, घंटे भर में आ जाएंगे या 2 घंटे में आ जाएंगे या शाम तक आ जाएंगे, हम बता देते हैं. So they are partner to it. Proactive measures to identify areas for improvement. Like again, I'm going back to this example. See, we got 2 areas. We understood that patient को हम नहीं बता रहे थे, and my pre-operative nurses were not empowered to question the doctors. So when we improved that, we got that area, that small छोटा सा gap जो था, वो gap में हमने improvement किया. So that itself was a big, big step towards patient safety, also a big step towards empowering nurses. Then is to assess effectiveness of CAPA. Like I told you, हमने जब एक event हुआ hospital में, then when we did the RCA, we found out that this is the reason. और उसको prevent करने के लिए हमें क्या करना चाहिए? Now we came to know that okay, if we are trying to do a prem, then we are doing a proper corrective and preventive action, which will go for a long way for the hospital, also improve the safety of the patient. This will improve communication with the patient and families, and opportunity to elevate patient's voice. Today's time, patient have the right as well as they want to get involved. Even one single vote can make the government and break the government. Like that same way that one single patient's experience can improve the quality, and that same patient can bring good number of patients to you. You do not require any marketing. If your quality parameters are so strong, you will automatically get good patients. You will have your own branding. You will live long in the healthcare industry, and people will respect the organization and the people working inside, because you are making them partner to their care. Gone are the days where we would say कि इतने questions मत पूछो. Today we tell them the resource will be available at so and so website. It would be good if you can read about it. You will get better experience. You will get better knowledge about it. आप ही के लिए अच्छा होगा. This is where we are going today. Okay. Just to brief you all with certain things about patient satisfaction with patient's experience. These are the questions which we hear very regularly. कि हम सेम चीज बोले जा रहे हैं. तो पेशेंट सेटिस्फैक्शन के लिए हमारे पास में एक पेशेंट सर्विस डिपार्टमेंट है, एक्सेलेंस डिपार्टमेंट है, पेशेंट रिलेशन डिपार्टमेंट है. तो ये पेशेंट सेटिस्फैक्शन देख रहे हैं, तो क्या वही पेशेंट एक्सपीरियंस भी देखेंगे? दे मे नॉट. बट पेशेंट सेटिस्फैक्शन एक डिफरेंट चीज है और एक्सपीरियंस एक डिफरेंट चीज है. वो क्या चीज है? लेट्स सी. नाउ से इफ यू आर डूइंग अ टिपिकल सर्वे ऑफ पेशेंट सेटिस्फैक्शन, तो व्हाट ऑल थिंग्स यू विल आस्क. सेटिस्फैक्शन में पूछा जाता है, वर यू सेटिस्फाइड विद डॉक्टर you are allocated with? How would you rate the overall care provided by our medical personnel? Okay, this is patient satisfaction. Now patient can say very satisfied, pathetic, very poor. They can put it like that. Patient experience. The question will come is, during this hospital stay, how often did nurse treat you with courtesy and respect? Very, very apt question. So someone will say, ex-nurse came and she was very rude, and she used to behave as if, she's doing a favor. There is another nurse who would come, say a Y nurse comes, she's very polite, very attentive. The moment I would call, tell my concerns, she would immediately raise that. Okay, so you would come to know, even amongst your staff, who are the ones who would require soft skills, who are the ones who would require improvement in their behavior. That is how it is different. Satisfaction में आपको वो नहीं पता पड़ेगा. Satisfaction में पता पड़ा वो हुआ या ना हुआ. Main approach in terms of satisfaction is outcome. What was the outcome of the care? But whereas in patient experience, you are trying to find out, did the things happen? मतलब जो उसका care था, वो जैसा होना चाहिए था, वो हुआ कि नहीं हुआ? Did the things happen as desired or did it not happen? Okay, so that's the basic difference which you will see in terms of patient satisfaction. It's more generic, fewer questions are there, and it is big, but it is suited for business. You want to show, our hospital has the highest satisfaction index and all those things. For those things, it is okay. When it comes to patient experience, it is a little more elaborate, more like a qualitative study, a mini qualitative study, you can say. वो quantitative हो जाता है, numbers होता है. Here, experiences cannot be put into numbers. It can differ from one to another. So that is what is a difference between patient satisfaction and experience. Patient satisfaction में आपको ये पता पड़ जाएगा, broad area पता पड़ जाएगा that okay, say hygiene is the problem in my hospital. People were not very happy with the hygiene of it, so I have to concentrate. You will never come to know that amongst the housekeeping staff, were they having the aptitude to work with the patient, or they were just told to do the work. So if you're not getting the right people on floor, then your work will not be done effectively. And today's healthcare is demanding for in-depth understanding, because human being has also become very complex. Patients are complex. Entire treatment has become complex. So you need to find out. Individuality is too huge because of awareness, because of education, because of complex treatments, because of a lot of financial aspects coming. Okay. So this was basic about your satisfaction. Now, prems can be available. There are a lot of prems which are available online. And bespoken are the ones which you can make it. So we'll just go through, before that, let us find out ye banta kaise. How are we going to make these questionnaires? So Picker's patient-centered model he had prepared, and this was, I think, in 80s he had prepared this. This was base for developing prem questions. How would you know which all questions are you going to include in these tools? Now, he gave cyclic form, and he told few parameters which he says if you include in your prem any department, say you want to take opthal department, you want to take patients coming in the opthal OPD, okay, or patients coming in dialysis, say patients undergoing MRI, patients who are on NPO, then site marking, anything, wherever you feel there's a gap in your hospital, you can use this model and you can find out and you can prepare a question. Now, what are the questions which are the areas which you can prepare? One is effective treatment from trusted professionals. Whether the treatment was from the choice of doctor which you gave during the time of admission. Continuity of treatment and regular referral systems. Say, for example, one patient wanted a second opinion. Did the hospital support you? Was a second opinion given to you? And if it was given to you, was the person qualified and competent enough to give you the second opinion? Then is participation in decision making and respect for preferences. Say if I do not like sandwich, I don't like bread, it's okay. Was my preference, was my choice been respected? Or I was told, no ji, in our hospital, morning breakfast is sandwich today, and I'm going to give you only sandwich. Was I given the preference of maybe a roti or maybe dalia? The porridge, what was that given to me or not? These are just example I'm giving. You can make any n number of questions. You can keep these parameters in your mind. This model is just to keep the parameters in your mind. There is physical well-being in clean and safe environment. Say the toilets were clean, the seats were always dry, the floor was dry. Was it safe for the vulnerable patient to walk? Those kind of things. Then emotional support, empathy, and respect. Be it the nursing staff, be it the doctors, be it the general duty assistants, anyone, or the management of the hospital per se, the front office, the radiology department people, the pathology department individuals, were they all empathetic to you, or there was some element? We feel that it is only the doctors and the nurses who are coming in front and giving information to the patient. Gone are the days, it is not like that. I'll tell you one example on this. I should share this. One patient gave us her experience, saying that in this hospital, I love this, aisa bahut acha tha, everything good, good, good. She just said one thing. When I was in ICU, I think I felt a little unhygienic, and it did not feel good that the nurse who took the sample from me did not use a tourniquet, she used the glove. And that gave me a very negative opinion about her as well as the processes in the hospital. Imagine a small thing like taking a sample. She took the sample very well. She was competent, but the patient did not like because the nurse used a glove. That too, a glove was a clean glove, examination glove. But then you are supposed to be using a tourniquet. So that experience the patient gave. So you have to keep that element, hygiene element, also in mind. Involvement of patient and family. So you can make some questions on that. Clear, understandable information and support of self-care. Was I, as a patient, informed that, many patients, they come post-operatively, they come after 7 days, 8 days, and they say they look so untidy, unclean, unhygienic. When we ask them, they say, we haven't taken bath from 7 days because we were not told. We thought that the stitches would get infected if we put water. So, we forgot doing that. So these are the questions which you should include in your tool. Then rapid access to reliable healthcare. Say if I am coming from, say, Uttarakhand, and I am coming here to this hospital only for surgery. Now, can I post-operatively go on coming from Uttarakhand every time to attend OPD? No, it is not possible. So the hospital should also provide me information. Anywhere else I can go and take. Reliable hospitals, I should have the list. So this also you can include in your prems. If you take these elements, you can prepare a good questionnaire with 10 questions, maybe 15 questions maximum, not beyond. And any department, any individual, any group of people, you can make prems and get it implemented in your hospital with great wonders. Certain ready-made questions which are available are through healthcare research and quality. AHRQ provides you questionnaires which are on emergency department, and as well as for national inpatient safety, like patients who are in the ward, for their patient safety, they have a questionnaire. So you can use these references and you can take it. The consumer assessment of healthcare providers and system also gives you ready-made prems, which you can just take it. They are validated prems. They are validated and reliable prems. You can just use those. These spoken questions are something which you have to prepare it for yourself. Now, for that, what you can do is you can find out where is the gap. Now, once you have found out, you can prepare a questionnaire. That questionnaire can be a pilot questionnaire. Pilot questionnaire means a rough idea, rough questionnaire. Those questions have to be having unambiguous answers. Unambiguous means दो meaning के answers नहीं होने चाहिए. The answers have to be simple, straightforward. The questions have to be framed very, very simple. simple language, understandable. Those questions, you have to get it tested in a small group. आप 5-6 patients ले लो. Those 5-6 patients, you have to get it tested. If they are requiring any modification, patients in themselves will give you the feedback on it. And if it is done, then you can get it validated from various experts, get a reliability test done, and then you can use these questions. So ये आपके बनाए हुए questionnaire रहते हैं for exclusively for your hospitals. May not be, say if we have prepared certain prems, may not be, it is not, may not be useful to you. Kaho has given almost 25, I think 20, 25 prems they have given. They have questionnaires. So they have also, that platform also gives you a lot of ready-made questions. Pitfalls. Pitfalls are कुछ चीजें जो नहीं कर पाओगे. Yeah, it will take difficulty index would be high. First, your management or your people who are sitting at the top should understand the value of prem. Otherwise, hospital would say, oh, we are doing satisfaction, we are taking feedback from the patient, we have a complaint box, we have this, we have that. Why do we want to have the experience of the patient? If your own leaders would not have that realization, then you cannot implement it. So you will have to first make them understand before the common man getting the knowledge about it. Leadership support is critical. Otherwise, implementation of prem will not be there and the outcome will not be there. आप पूरी मेहनत कर लोगे, उसका कोई यूज ही नहीं होगा, तो मतलब नहीं है इतनी मेहनत करने का. Now you have to identify areas for implementing prem. Say for example, my cardiology unit, the CTVS is very good. I don't see any gap over there. I feel the patients are very, very satisfied. I don't think we have to do a prem over there. I have to do a prem in an area where there are gaps, where there was an event in the past, or where I have found that the patient satisfaction is low. Those areas we can do prems. Questions have to be unambiguous and very, very straightforward. Data collection and analysis has to be intensive, and usually we do it in Excel, so it is easy to analyze it. So though it is labor intense for people to go, data collection is difficult, analysis becomes not that difficult. So yes, you will have to have a team. You alone can't do it because you'll have to have the experiences of the patient in different hours of the day or night also. Okay. Validation of the tool is very, very important. I have, say, made 10 questions. Now, I feel they are absolutely perfect. When I give this to 5 experts, say 2 doctors and 3 senior nurses, they say, what is this? No, this question does not look correct to me. You can modify this one, modify that one. So that will happen later. Okay. So you need to involve your seniors also. You have to involve some experts also. Experts can be from your own hospital or from some other hospital. Okay. So that validation would be required. There are certain limitations. Amongst them, it is important that all stakeholders realize the value of prem. I have already spoken. Leadership support is critical. Key areas, I think this is by mistake. Okay. Few things here is it can become subjective. Subjective matlab, I told you in the early initial of this session. You also underwent the appendectomy. I also underwent appendectomy. My experience can be different, extremely different than your experience. So there will be a lot of subjectivity. Now, how can you come to that equalization? Say if I have checked it with 10 patients and only 1 patient gives complaint, does that mean that that 1 patient satisfaction or experience should not be counted? No, it should be counted. It should be counted. That in fact gives you a learning. Okay, you can get this kind of a patient also. Patient can get offended for these things also. Like we take so many blood sample, only 1 patient got offended by using a glove, whereas he was very correct, absolutely correct. When we have given a tourniquet, when tourniquets are available every bedside, then why was the nurse using it? She did not find it, so she used it. But that was her convenience. Patient did not like it. Patient experience did not give a good feedback about it. Okay. So even if one feedback, subjective feedback you get on the experience of the patient, you have to respect it. Few examples. Now come the real part. Examples of say pre-operative prem. मुझे अगर pre-operative area में मुझे prem करने का. What all things I will include? Advice about pre-operative fasting. So I can ask a question to the patient that from how long you have been fasting? Did the nurse inform you that these many hours you are supposed to be fasting for this particular procedure? Information about anesthesia. Did the anesthetist meet you? Did he or she inspect you? Did the assessment? What kind of anesthesia are you going to get? Are you aware about it? What are the side effects of those anesthesia? Clearing of the doubts. Then you can again make 2-3 questions over there. That did your surgeon tell you what is your disease? What is the surgery you are going to do? What body part is going to be removed from you? And can you live without it? And if you can live without it, what will be the compromise? Okay. So these are just basic things on which if you want to make a pre-operative prem, these all areas you have to include. Involvement of site marking, explanation about post-operative pain management. In the pre-operative phase only, we are supposed to tell about post-operative. That when you will come into consciousness, you will have some amount of pain. And that pain, you are supposed to report to us. We can give you medications. Gone are the days where you used to say, सहना तो पड़ेगा ना, दर्द सहना पड़ेगा, ऑपरेशन हुआ है तो दर्द सहना पड़ेगा. No, it is not required anymore. We have good treatment available. So did the hospital or the doctors who are there or the nurses who are there, did they inform about pain management? Did the patient expressions were respected? Hand hygiene of the members. You have to tell, believe me, this we have done again. We did a audit on this and there were a lot of patients who participated. And the moment the nurse will come to them, they will say, sister, did you sanitize your hand? And they were telling yes or no, whatever, if they have not done. Many a times there were some very, there's some patients who become like family. So they would say, sister, come, I'll give you the sanitizer. So, they get involved in it. So these are certain questions which you can add if you want to do a pre-operative prem. Okay. Anyone, any question in this? Or we can deal with it at the end. Okay. Second example I want to tell you about is MRI safety. Now, MRI, when the patient is going for MRI, MRI is a very busy area. One patient will come out, the next will go. So you will have to tell the patients what will happen. There'll be a lot of noise. You will get a claustrophobic kind of a feeling. You'll go into a chamber. This much time will be required. This medicine will be given. You will be the only person inside it. So patient has to tell कि मुझे ये सब बताया कि नहीं बताया. So you have to make certain questions. What all areas you will involve is advice, not carrying any metal inside, pre-procedure inquiry about past surgeries, implants. Say if a patient is having a permanent pacemaker, those patients can't undergo MRI. So did someone ask you about it? Ask about pregnancy, advise about seeking help, because many patients, they feel that they are closed in a chamber, claustrophobic feeling comes and anxiety increases. So they will not be able to, cooperate well if you are not informing them. Then information about avoiding movement. If any patient is moving too much, getting anxious, how would the MRI would happen? So all these things can be, these are certain areas of doing prem. I'll tell you one questionnaire which we have prepared for our place, that is on endoscopy. in the endoscopy suite, we have a lot of patients who come OPD basis, IPD, and a lot of endoscopies are done. So we thought of doing a prem on endoscopy. Now, what all, this is a questionnaire which we prepared, got it validated, got it reliability done, and then we implemented this also. This project is now also going on. What all questions did we include in? Did any of our team member verify your name and hospital registration? So IPSG goal, that was your identity checked. Did the doctor explain the need of the procedure to you? Were you given a chance to clarify your, were you given the chance to clarify your concerns and doubts about the procedure? Were you given a clear idea about the possible cost and expenses? Were you informed about possible need for bowel preparation? Were restrooms easily available and to acceptable cleanliness levels? We even ask them, because many a times when endoscopies are done, people feel like going to the washroom and bowel clearing. So we even ask that, were the washrooms available first? Because there are a lot of patients which come. So were they available also? And if they were available, were they clean? Was your explicit permission taken, including your signature consent from before the procedure? ऐसा तो नहीं हुआ आप जस्ट आए और बोले जल्दी इधर साइन करो, आपको पढ़ने का भी टाइम नहीं दिया. Those all things we checked. Were you offered the option of undergoing this procedure under anesthesia? Did the team ensure that you had adequate privacy during procedures? Did all the team members use proper hygiene? Did the team respond adequately to pain and pain you experienced? Did the nurse assess you after the procedure? And were you given relevant education and follow-up instruction after the procedure? Now, with these questions which are there, you can very well identify where is the gap. And you would not believe the gaps which we got, which we never thought that इस जगह पे गैप, हमने तो सोचा था डॉक्टर के लिए गैप आएगा, नर्स के लिए गैप आएगा. But believe me, nothing from that end came, something else came. That, we had to wait for the washroom. So we understood that we should be having more number of washrooms in the endoscopy area. We also found out one simple thing, that privacy for few patients was not maintained. So for us, it's a procedure which we are doing it like every day, so many. So it is not coming in our head that did I cover the patient, curtains were on or not. We are just doing it mechanically. But patients, they feel it. They understand that something is going wrong with me because I'm an individual, respected individual. Okay. So these are certain practical things. This is how you are supposed to be. जो भी theory पढ़ाई आपको, this is how you are supposed to make it. And this is how. Now for each question, you will find out, say, if you have taken 20 patients or 30 patients. Out of 30, how many said कि registration किया था? Out of 30, how many said that yes, they explained the procedure? Out of 30, how many said that their concerns were taken into account? Okay. So these are few things which you'll have to keep it in mind. This is how I think we have already done this, that how you are going to take the, conduct the prem. One is make a tool, rough tool, do reliability, validity, data collection, analysis, and then present it. This I think we can skip. Basically, you have to understand that we need to walk the talk about healthcare quality. The more you talk about a particular thing, if you're going on harp on quality, your quality improves also. With your work, not only talking about it and doing nothing on it. But yes, go on talking about it, improve, go on improving small steps, and you will improve your quality. Ensure quality at every step in each care episode. Prems are simple yet effective method to elevate patients' voice and assessing the performance of the team. Otherwise, the team will start believing that मैं जो कर रही हूँ सब बढ़िया है, बहुत अच्छा है. I'm the best. Okay, so no one is Shah Rukh Khan over here. No one is best. We go on improving our benchmarks. We go on shifting the benchmark up and up. There's no end to it. Sky is not the limit also. It can go beyond the sky also. Okay. That's why it is said that quality is never an accident. It is always the result of intelligent efforts. And that's why you have to go on harp on the quality. Few references for you. There are many more. If you hunt the internet today, there is no end to it. So this was from my side. If anyone comes up with questions you want to ask, anything would be great.
Students, I think we're open for question and answer round. Anybody who's interested, please do ask Deepa ma'am as many questions as you want to. This is a golden chance for everybody. Charul, if we have any question on the chat box, I think we can talk about that as well. I think, ma'am, some of the student has asked, what is the meaning of CAPA?
Corrective action and preventive action. Corrective action is, say for example, a patient had a fall in the washroom. Why it happened? You did a RCA, root cause analysis. You did a root cause analysis. You found out kyun gira patient. Now you found out that the washroom was wet and that is why patient slipped. Or the patient was wearing a slipper which was of, rubber, which was very smooth rubber. Okay, so you found out these two reasons. Now what is your corrective action is? You immediately got the washroom wiped out and made it dry, and you gave a slipper which is non-skid slipper to the patient. So ये हो गया आपका corrective action. Preventive action is you will include practices in your hospital wherein the washroom, the housekeeping staff will go on wiping the floor frequently. It can be half hour, 1 hour, depending upon the need of the area. As well as you will remove all the slippers which are of smooth nature, and you will buy all the slippers which are non-skid slippers, or you will permit only those slippers from the patient side, or you will not permit. वो हो गया preventive. So long term also you have to think. That is what is CAPA. You don't have to think only of today, you have to think of the future also. Okay? Yeah.
Okay, ma'am.
Roja, would you like to ask some question?
No, ma'am. No.
All right. Okay. Anybody who would like to ask any question?
Your device is ready to pair.
If you would like to ask a question, then unmute yourself. Otherwise, please mute yourself.
Anyone else?
Students, any other question, please?
Please send the PDF.
Well,
Yeah, I have shared my presentation with Astron. They will share it with you.
anybody else? Any other question? No. I think, ma'am, I'll head toward the vote of thanks. Good evening, everyone. It was such an honor to be a part of this wonderful event. On behalf of Astron Institute of International Studies, Gurgaon, I would like to extend my heartfelt gratitude to our esteemed expert, Dr. Deepa Chugh, Nursing Head, Akash Hospital, Dwarka. Thank you, ma'am. A humble and very sincere thanks to the entire team of Astron counselors who have worked day in, day out to get all our students on board. Finally, I would like to thank all of you who are present here for making the time to be with us today and helping us make this event a great success. Thank you, everybody.
Thank you so much. It has always been a pleasure being with students. Initially, I never used to find this online thing very great. But, believe me, from the time I've been associated with Astron, my concept changed. And now I think it's not that it doesn't give knowledge. It is depending upon the student. If the student, I can be one student, I can be a learner. So if the learner wants to learn, then this is the best platform. And, you all select such apt topics that many of my nurses also, I encourage them, probably they would also be in the team today, that they should also join up. And learning is immense. So thanks to the, to Astron Group that you are taking this much efforts.
Thank you so much, ma'am. And we keep on introducing new courses, and very soon I think we'll be coming up with some new courses as well. We've got a variety of courses which are accredited with the NABIT, with the ISO, and also training partnership to Skill India. So we've added a lot of plethora of courses to us, whether it is infection control, quality, nursing administration management, and best part is nurses. I think learning is a never-ending process, ma'am. Even
Absolutely.
And we keep on learning each and everything. Something new we learn every day. So I feel this is the right thing we should do. Keep on learning and keep on moving ahead. Thank you, ma'am, for your motivation. Thank you so much for your valuable time. Thank you so much.
Thank you. It's a pleasure. And good luck all the learners who are there.
Thank you, ma'am. Thank you so much.
Thank you, ma'am.
Thank you, ma'am.
Thank you so much, everyone, for joining our webinar.
Thank you. Thank you so much. So I can take your permission to exit?
Thank you so much, ma'am. Thank you.
Yes, ma'am.